back, everybody. It's another episode of Holistic Growth West Living. I'm your co-host, Chris Angel, and I'm here with your host, as always, Amber McKenzie.
Hi, everybody.
Amber, hello.
Hello. How are you?
I'm good. I'm excited to hear what we're talking about. I have I don't even know where we're going to go with this conversation, but
I don't know. It's exciting. It's exciting. It could go anywhere, really.
Why don't you just tell me what it's about first so everybody can be excited with me?
Okay, we're going to talk about sex.
What? Yay. That's fantastic. That we can go a lot of directions there. So
yeah.
Awesome. Well, talk me through it.
Let's do this. So I've got Dr. Jacob Deakins from Inland Wellness and Vitality with us today. And so I'm really excited about this because let's just put it out there. Sex is a topic that people don't like to talk about. And they really don't like to talk about it with their doctor. At least that's been my experience. It's very uncomfortable. And so today we're going to talk about sex like we're talking about the weather, because that's what we do with Dr. Deakins. He talks about sex like you talk about the weather.
Love it.
Yeah. So
it's true.
Yeah, it's true, right? I mean, there's nothing off limits as far as I can tell.
Yeah, no, that's good.
Yeah.
Can't wait to see where we go with that.
Right? Oh,
sorry about that.
Probably got a call. Somebody wants to talk about sex.
People are calling in. I thought this was a call-in show. People are calling in. Yes, caller number one. What is your question about sex?
We'll just turn that off. Sorry about that.
Okay. No worries. No worries.
That's great. That's great.
So, Dr. Deakins, we're really happy that you're here with us. First of all, why don't you tell us a little bit about what it is that you do at Inland Wellness and Vitality, and a little bit more about your background.
Sure. So I've been in medicine for several years. About 2 years ago, my business partner, nurse partner, office manager, younger brother Peter, and I decided to open up this practice. Our initial thought was to focus on men's wellness and health, particularly sexual health, like you mentioned. It's not a topic that's commonly addressed other than the, very subtle, let's have a little blue pill. Man checks in for an ankle pain and then ends up leaving with Viagra, for example.
Right.
So a lot of physicians are not comfortable addressing the topic of sexual wellness and health. And so men pick up on that, women as well, and they're very reluctant to talk about that. So we started out offering several different therapies at our clinic and at this practice that not only address the root cause of erectile dysfunction from a functional standpoint, hormone management, diet, exercise, those types of things with disease management, but also from a functional standpoint of offering a therapy called Gainswave therapy, which uses acoustic wave energy, which the old term for was extracorporeal shockwave therapy, very similar to the therapy used today in kidney stone, lithotripsy, but at lower frequencies to regenerate tissue within the penile vasculature to achieve better erections without the use of pharmaceuticals. So after opening, it's been, like I said, almost 2 years, we've delved into sexuality as far as men's health as well as women's health from a hormone optimization, vaginal dryness, hormone loss, stress urinary incontinence, a lot of different things that allow women and men to enjoy their sex lives indefinitely. Really is the hope. And like you said, sex is like the weather. It's either good or it's bad, right? And most of us want that good weather versus the bad weather. So
right,
that's what we're doing.
Okay, I love it. So yeah, when you talk about like sexual wellness, I know that you actually wrote a really great article for Natural Awakenings last year in November. And I remember reading that, our sexual health is related to our overall health. Can you expand on that a little bit more just to help listeners kind of understand how that does affect our whole life?
Sure. That's a great question, and it's something that we deal with frequently. But there's been numerous studies, both multi-center studies across the United States, national and international studies in other countries, looking at sexual satisfaction scores, and they have clinical tools and questionnaires that are used to assess that level of satisfaction in both men and women. And by using those scoring criteria, you can get a baseline of where somebody's at in their sexual happiness, essentially, is, and their satisfaction with their sexual health. It's a way to take very subjective data from a patient and from a population and put it into a very objective format. And then using that data in studies, they look at people that are more sexually satisfied and more pleased with their intimate relationships tend to have lower all-cause mortality, meaning whatever it is that's going to kill them is less likely to kill them when they have a good sex life, right? Very multiple studies that have looked at that, addressing any other variables that might confuse those results. So, taking those all into consideration, the essence of most of those studies is the more often you're having sex and the better it is, the longer you live, the lower your blood pressure, the less rates of depression and anxiety, the better your sleep, the better your health. So it definitely plays a role, and it's always been a bit quizzical to me why, as physicians, we're not asking about someone's sexual life, and perhaps it's because it's a taboo or it's a difficult topic for some. But in my opinion, it's no different than asking about somebody's blood sugar and about their dietary intake and if they're exercising and all of those different things. Mm-hmm. And I challenge my patients and ask each and every new patient I have is, when was the last time your primary physician, your gynecologist, your specialist, anyone has talked to you about sexual wellness and health? And almost 100% of the time, it's a resounding never. Yeah. So, it's again, we want to create a safe atmosphere where we can talk about health in a non-threatening environment with somebody that understands the physiology, the pathophysiology, some natural treatments that we can do to address it. We work closely with a couple of counselors here locally that deal very specifically with sexual counseling if there's other issues that need to be addressed that we're not comfortable addressing. So we want to have a very multifactorial approach to this, just like anything else in medicine, right? So
yeah, nice.
I would say,
oh, go ahead, Chris.
Well, I was just gonna say, I think for, if everybody's being honest, and you don't have some traumatic experience in your background that has you feel negatively about sex, most people want to have more sex. But I think one of my question is, what is the biggest thing that prevents people from coming to see you to improve their sex life?
I would say it's probably just the prevailing attitude, perhaps, that there is not a lot they can do about it. There are many people that do not want to rely on a pharmaceutical intervention to achieve erection for men, for example. There are definitely side effects and cost issues that are prohibitive to many people to go that route. I think it's just spreading the news that, number one, there is a physician available that's comfortable talking about this, that's very well educated in regards to how to address these different issues, and that is willing to work with each patient on an individual basis to achieve whatever their goal is. So we operate on a very deliberate schedule at my practice, where we tend to spend about 30 minutes to an hour with every patient, depending on their needs, without a lot of overlap in booking appointments. I'm not very interested in bringing a large volume of people through here, but we are very invested in bringing quality interventions and quality health and quality time with our patients. So I think it's just access, getting the information that there are different opportunities and modalities available.
Yeah. And would you say that in your experience, because I remember you telling me this once, that a lot of times people don't actually know that there's a problem, and you've actually said that you've had couples come in because the man wanted to have a natural approach to his sexual health, and then the wife ends up coming to you as well because she's got some issues that she didn't realize could be helped by you. Is that something that happens a lot?
Yeah, Amber, that's absolutely correct. And initially, when we opened the practice, we were just dealing with men. That was kind of our niche at that time. But it didn't take much longer than about a month or two before we started realizing that the spouse was in the background saying, hey, he's now ready to go, and I'm having these issues. And so we very promptly started addressing those issues and looking for ways with my training and different therapies that we could offer to address those for women as well. So it obviously takes two to tango, and addressing one partner and not the other is a bit of a problem. And it's been well known that even after some of the drugs that we use, like Viagra, for example, was introduced, there was a massive outcry almost from the women that were saying, hey, we had kind of reached this plateau in our relationship, and now our partners are ready to go again, and that's not okay with us. And there was a lot in the literature at that time about who asked us.
Right. Yeah.
And it was very much driven by the male without a lot of discussion from their partners. So we want, I love it when spouses come in because we can address the entire package, and most of the time I get the truth from the wife and half of it from the man.
Right. Yeah.
We tend to be less likely to share, it seems. So
yeah.
It feels, if I had to summarize, I'm so on the outside of this conversation. I haven't met you before. I didn't read your article. I don't even know about this therapy. I know about blue pills and things. But as it relates to this, if I had to summarize what you've said so far that I understand, you do a natural, people can take pills or they could do a more natural approach. So you do a more natural approach.
correct.
And you do it for men and you do it for women. And you use something that is like sound waves and I'm assuming that's both for men and women because the technology works for both.
Yes.
What, like, can you make it more concrete? Like if I'm thinking about, I'm a man and a woman, I'm a couple listening to this interview, and I'm like, I still don't get it. Like, is he going to attach some some shock things to my balls and is
That's
it
a good
like,
question.
What happens? What happens down there? Yeah.
I mean, I'm really nervous, right? I'm like, it's so abstract. I don't want to have anything happen to me.
Yeah, it's very abstract. And so we definitely can go into more detail, Chris. One of the reasons we've gone away from kind of the old term, the ESWT or the shockwave therapy, is there's no electricity involved. It's a sound wave that's generated much like you would get an ultrasound done to look at a developing baby, or have an ultrasound done for an injury to your knee, for example, at the physical therapist's office. Unlike ultrasound, it's an audible sound. So it's a sound wave on a frequency that you can hear, and it's creating percussion. And when we stimulate the tissue, particularly the penile tissue, we're really looking for 3 different things to occur. First and foremost is that mechanical action, much like it will break up a kidney stone, will break up any small plaques that are present in the penile tissue. So we're increasing blood flow naturally, non-invasively, with very little discomfort, if any, to the patient. So you're almost immediately getting a return or a greater amount of blood flow. And that's been studied with Doppler blood flow and ultrasound, showing that, yes, you can get more blood into that tissue, and erections are blood flow dependent, 100%, right? The second and third thing that happened at the cellular level. So it's very much a biochemistry type situation that's happening in the tissue. You're releasing nitric oxide through this tissue stimulation. Nitric oxide dilates blood vessels. Viagra, Levitra, Cialis, that whole class of medications, which are called PDE5 inhibitors, are working on that nitric oxide system. So by releasing more of our own natural nitric oxide, we have less reliance or no reliance on the little blue pill. It's very much shown that nitric oxide levels in the tissue rise after a protocol is completed and even during the treatments. And the third thing that's being done is something is being released called VEGF1, vasoendothelial growth factor. Big fancy word, right? It's basically fertilizer for blood vessels. So we all have vasculature, branches of the tree, and this VEGF1 stimulates the production of new blood vessels. So in men, if you can create more blood flow into the penile tissue, you're going to have a better erectile response.
Right.
And 40 plus published studies that are peer reviewed and blinded studies on the efficacy of this acoustic wave therapy for erectile dysfunction, showing that a good percentage of men, maybe even 60%, can completely eliminate the little blue pill, right? So that's a fairly significant reduction. And then some other modalities like optimizing hormones, looking at testosterone in men. It's very common in men as we age. We decline every year after we peak. Most of us peak in our testosterone production in our early 20s. And thereafter, it's a slow decline. And so we go through this andropause. And there are different perspectives on hormone therapy. I choose a bioidentical or a biomimetic approach. It's very natural. It's very safe. It has very few side effects. it's evidence-based, so it has studies and information behind it. And we can get men to an optimal level, because the ranges we use in medicine are population-based. They're not clinically based. So this wide reference range may not be applicable to you, Chris. It may not be applicable to me.
Right.
Every man's a little bit different. So instead of treating a lab value on a piece of paper, I choose to treat my patient and their symptoms and their individual case.
Wow.
Awesome. And tell us a little bit what you do for women that are experiencing, like after childbirth, like there's a lot of things that happen in hormones as you age. What is it that you help women with?
So from the hormonal standpoint, women generally go through menopause very abruptly. The average age is about 50. But in the decade leading up to that, this perimenopausal timeframe can be very problematic for a lot of women, where they start noticing things like lack of lubrication, vaginal laxity or looseness after childbirth, particularly loss of sensation to that tissue, increased instances of urinary tract infections because of the change in the acidity and the texture and the pH of that area. And a lot of that is a consequence of hormonal deprivation and loss over time, as well as mechanical trauma from childbirth. So we have some therapies that can address that, essentially rejuvenating the vaginal tissue from a non-surgical standpoint. Hormone optimization definitely helps with the vaginal pH, and those levels reduces urinary tract infections, increases lubrication, sensitivity, libido, arousal, all of those things that we're aiming for. And then we have some other procedures that are minimally invasive or non-surgical to help tighten the vaginal tissue, increase the pelvic floor muscle tone, very much like Kegel exercises, for example, but it's done through a monopolar radio frequency energy. So radio frequency energy heats the tissue very slowly and gradually, and allows collagen to be produced naturally and muscle tightening to occur naturally, which will eliminate things like looseness, laxity, loss of sensation, stress urinary incontinence, which is when women laugh, cough, sneeze, and they have a little urinary leakage. Many women will limit their lifestyle, such as jogging, yoga, any kind of physical activities because of that leakage. So these therapies can address that without any invasive surgeries, with no downtime, with no restrictions, with very few contraindications of why the therapy can and can't be done. So
is there a certain amount of time that is required in the therapy? I would imagine it's different for every person, but like, is there a range of like 2 days or like 2 weeks or 2 months to something?
So on the Gaines wave therapy for erectile dysfunction, it's typically a series of 6 treatments at minimum, is usually effective in 95% of our patients. Of course, that's coupled with hormone optimization in a fair amount of those men, which will obviously play a role. The female treatments are anywhere from 1 treatment to 3 treatment, depending on the severity of the condition.
Wow.
And generally, those effects of those treatments are considered long-term, not definitive, permanent. You may need some maintenance treatments 2 to 3 years down the road. Obviously, we're all going to progress, continue to decline in our health. What we're trying to do is set the clock back a little bit, Chris, and make sure that we can optimize what we can optimize at that time. Yeah.
That's amazing. Three treatments for women and 6 for men. Like, that's incredible. That's incredible.
Yeah.
Mm-hmm.
So,
wow.
Yeah, and they're very effective. Like I said, we're sneaking up on 2 years at this practice. We've treated probably over 200 men to date very effectively. My success rates are comparable to what the studies show, perhaps even a little more, because I'm bringing in probably more of the picture than just the technical procedure. We're looking at diet and health and hormones, talking to people about ways to lose weight through dietary management, staying active. We have health coaches that we can get people connected with, therapists. So it's a whole picture instead of being so siloed in medicine where everybody just gets referred elsewhere. We're trying to address the whole picture.
I have a fringe question for you. I'm not sure that's exactly related, but I think one of the ongoing jokes of men and sex is that, you know, it lasted 2 minutes or it lasted like a minute. Like sex was great for 30 seconds.
Sure.
Is this type of therapy also helpful in increasing stamina?
Absolutely, yes. So there's a lot of men, and it seems counterintuitive because it'll address multiple issues, but some men lack sensation, and this will improve sensation. We've treated many men successfully for the condition of premature ejaculation. So that kind of, you know, joke of all 30 seconds of it, we're able to increase stamina with that. The studies show that there's improved erectile function across many different parameters.
Yeah.
Length, girth, vascularity, sensation, force, velocity, distance of ejaculation, however you want to quantify that.
Sure.
Refractory periods are decreased, so the ability to ejaculate and then have another orgasm within a shorter period of time, much like it was when we were younger. So a lot of parameters improve, and a lot of these questionnaires that look at sexual satisfaction scores look at those parameters before and after, and we see an 85% improvement in men from baseline after one of these protocols. And that corresponds very well with what the studies are showing. So you absolutely can address premature ejaculation.
Yeah.
That being said, sex is very multifactorial. There's an emotional component, there's a spiritual component for many, there's an intimate component, a lot of different things. And from my standpoint, when there's something that I can't address with the therapy or the medical treatments that we offer, we have resources within our network that can help people with those issues as well.
Yeah. I think when, well, I'll just say as a guy, I can only speak from my experience. I think as a guy, it's an emotional thing there's an ego part of it that's like, I want to know that I can provide, you know, happiness for my wife, that I was able to produce a result, right? That I showed up and I hung in there until my wife could have her moment. And it was great by all. And to not be able to do that causes some emotional chatter in the back of my head. That's like, maybe I'm not all that I thought I was, or maybe I'm not the man I thought it was, or maybe I can't provide and produce results. So I think there's a lot of men that bury their head in the sand and don't really want to look at this side of it, the emotional side of who you now think you are because you can't produce a result you once could. And
Correct.
So then we just, you know, mail it in and like get what we can get. And actually, by the way, sorry, I'm sort of on a soapbox, but I think that type of thought process can actually lead to people going outside of marriage for, sex, but beyond that, just the psychological relief of feeling like I can produce a result.
Yeah, Chris, I think I would second that thought that many times, you know, when you look at the journal articles, the psychiatry articles on infidelity and, you know, going outside of the bounds of a relationship for sexual gratification, very seldom is it biologic or physical in nature. It's mostly emotional, where a need wasn't being met. And that's why, if we go back to the beginning of this conversation, I love it when couples come in together, because then I usually get the entire story. And very frequently, I hear from the husband, particularly, that I worry that my wife is going to think that I'm not attracted to her, or that she doesn't do it for me anymore, or that I can't be aroused by her, when he has a very real medical condition. And the largest goal that he has in his mind's eye is to pleasure his spouse and to make her happy and to fulfill her. And so when the spouse can hear that from the husband, I think there's some healing that occurs, which is amazing. And a lot of just being able to talk about it in an environment where you're not surrounded by a lot of people in white coats and jackets and things, with 1,000 different staff members processing your information, is very healing for a lot of men as well. They have an outlet. They can finally talk to somebody about this. I joked with Amber before that, you know, growing up, my parents were kind of like Meet the Fockers,
Right.
very, very open, early education about sex and the importance of sex and intimacy and a lot of different things. So it wasn't a large departure from my personal mindset and philosophy to bring this into a medical environment and to talk very comfortably with people about it, because it is important, right? And when spouses are there together, that's, I think, when we get the most traction out of these therapies.
Awesome.
Yeah, so good. Really important work. Wow.
So yeah, it's fun.
Well, if people want to learn more about this kind of work, I love how you explained it, and I didn't know it was there. I didn't know about this. This is really interesting. How do people?
Cool.
Yeah, how do people learn about it and reach out to you?
So you can check out our website. It's Inland Wellness and Vitality. That's a mouthful. So you can go to www.iwavs. So it's iwaves without the e.com. We're located at the Rock Point Business Complex off of Washington and Boone here in Spokane. You can reach out to us at 474-0145. And you can come in for a free consultation. That's another thing I should mention. I want people to come in and feel free to ask questions. So it's always a no obligation, free consult for any of our therapies, any of my time, and we'll take the time to sit down with you. It's not just a cursory thing to come in. We want to really help people and spend the time to figure out what's going on with them. So.
Oh, really good. Amber, what about you? If people want to reach out to you, learn more about the Holistic Chamber of Commerce or the Natural Awakenings magazine, how do they reach out to you?
They can go to holisticnorthwestliving.com. That's holistic Northwest spelled out, living.com. And they can be taken to either, the more information about the Holistic Chamber of Commerce here in Spokane, and then, or Natural Awakenings magazine. So do check that out, and then you'll be directed to where you want to go.
Awesome. Really good. Thanks, both of you, for a great episode. I think this is a really important topic that doesn't get talked about enough. And so I love that this is out, and I look forward to sharing this wherever we can share it.
Thanks, Dr. Deakins. This was great.
Yeah, welcome. Thank you.
Yeah.
Awesome.
Have a great new year.
Take care.